Are you struggling with digestive issues, such as heartburn, indigestion, or diarrhea? Gastrointestinal (GI) agents can be your saving grace. These medications and substances are specifically designed to manage and treat disorders of the digestive system, providing much-needed relief. Let's start with antacids, the go-to solution for heartburn and indigestion. They work by neutralizing gastric acid, thanks to alkaline substances like aluminum, hydroxide, magnesium hydroxide, and calcium carbonate, while antacids offer quick relief for occasional symptoms. It's important to note that they don't address the underlying causes of acid production. For more chronic conditions such as GERD peptic ulcers or Zollinger-Ellison syndrome, proton pump inhibitors, PPIs, like omeprazole, esomeprazole, and lansoprazole are highly effective. These powerful agents inhibit the proton pumps in gastric parietal cells, significantly reducing stomach acid production. However, long-term use of PPIs may come with certain risks, such as nutrient deficiencies and gastrointestinal infections. Another reliable option is H2 receptor antagonists, like ranitidine and famotidine. These agents block histamine receptors in the stomach lining, leading to decreased acid secretion. H2 receptor antagonists are great for managing mild to moderate acid-related conditions, offering both short-term relief and long-term maintenance therapy if you're dealing with diarrhea caused by infections, dietary factors, or underlying gastrointestinal disorders. Antidiarrheals can help. Loperamide, Imodium, slows down intestinal motility, reducing the frequency of bowel movements. On the other hand, bismuth subsalicylate, Pepto-Bismol, not only has antidiarrheal properties but also anti-inflammatory effects. With the wide range of GI agents available, you can find the right treatment to alleviate symptoms of conditions like GERD, peptic ulcers, constipation, diarrhea, and nausea. Take control of your digestive health with these essential medications and substances. Laxatives are important for treating constipation, and they come in different types. Bulk-forming laxatives, such as psyllium, increase stool bulk by absorbing water. Stimulant laxatives like bisacodyl stimulate intestinal motility, while osmotic laxatives like polyethylene glycol draw water into the bowel to soften stool. Emollient laxatives like docusate lubricate the stool for easier passage. For managing diarrhea, antidiarrheal medications like loperamide and bismuth subsalicylate can help by slowing intestinal movement or reducing fluid secretion. Loperamide is effective for acute non-specific diarrhea, while bismuth subsalicylate can also treat symptoms like nausea and upset stomach. Using gastrointestinal agents properly can greatly improve patient care by relieving discomfort and managing digestive disorder symptoms. Healthcare providers need to assess the underlying causes of GI symptoms and consider the potential side effects and interactions of these medications. Patient education and adherence to prescribed regimens are crucial for optimal therapeutic outcomes. The choice of a specific GI agent often depends on the patient's condition, medical history, and individual response to treatment. Regular follow-ups can help ensure effective management of gastrointestinal issues for improved overall health and quality of life.